unconventional or unorthodox, if you wish, space, if you were to talk about, for instance, traditional healers. And then research and innovation, that it would assist this objective if we begin to share research across the continent. Plenary sessions, the first plenary session considered the question of reforming training, education, and practice for the future. And some of the key issues that were identified included the need for education and health departments to work together on the training of health workers. In some jurisdictions, case in point South Africa, the Department of Health and the Department of Education are partners in the production of healthcare workers. And as a result of that, sometimes there are regulatory gaps, and these then compromise either the production of the healthcare workers or the delivery of care finally. And then there was also another issue that was identified, was that the need to form an intersectoral committee on health workforce. And this speaks to the first issue that I raised, that if you got this intersectoral committee, then the contribution of all these sectors to the production of this single healthcare worker is harmonized and integrated. And then it was also noted that the curriculum is not integrative of indigenous perspectives. And again, it is about designing a system that is whole, that will address societal needs as a whole. What challenges were identified? Insufficient human resources, this we know. Underfunding of health programs, this we know. What recommendations were made or considered for implementation? Strive for the same entry criteria, learning objectives, exposure to learning processes, accreditation standards, and exit criteria. Standardized assessment methods. Use the same accreditation standards and processes across all learning institutions. So in conclusion, the discussions emphasize the following: that we need to formulate policy to support the curricular review and standardize curricula in Africa. So in terms of this, now the action point, that we need a policy to achieve that end. Second plenary session looked at the use of innovation and digital technology in healthcare, and the key issues that were identified, some of them, I'm just going to mention two here: to establish communication pathways to facilitate the use of telehealth technologies in response to healthcare emergencies such as COVID-19. In some jurisdictions, again, this had to happen as a matter of urgency because it was a key ingredient to responding to the COVID-19 pandemic. And then there were other issues that were identified pertained to the regulation of digital technologies in training, but I think more importantly, in the delivery of care. So the regulation of this sector is lagging, leaving it vulnerable to fraud and loss or inappropriate disclosure of patient health information. What challenges were identified? Budget. The implementation of technological changes would need resources and budget allocation, which obviously is variable depending on what emphasis or what focus a particular country takes on a digital technology. Creating a digital database, but also being aware that this requires awareness from the users of the database. So meaning that creating the database by itself, that should not be an end in itself. The users of the technology, including the practitioners, should also attain sufficient and adequate, appropriate literacy thereof. Recommendations: collaboration between different regulators to ensure all their practitioners have their data loaded on a single database. I think this you can think about if you're struggling within country to get this done. I think one can imagine what would then happen if you want to do it across countries. But it is an ideal, it is an objective that would address some of these challenges that we've raised. One of the recommendations that we needed new regulation for telemedicine, which will obviously assist in increasing access to care. I want to go to plenary session 3, which looked at the distribution of the health workforce to deliver universal health care. What were the key issues? Some of those issues included a need, a need to have a robust conversation on training, absorption, distribution, remuneration, and retention of health workers. A need for interprofessional education and collaborative practice for better patient outcomes. I can actually add here that not only would this be beneficial to patient care, but it would optimize the resources available for training these healthcare workers. And the distribution of healthcare should start with recruitment of trainees from areas that are underserved, areas where there is a need. I think you'd have heard from one of the panelists here the examples that were given yesterday. And in doing all this, there also is a recognition that the managers need appropriate training to understand what the objectives are, because the managers are going to have to drive this process. So management training was an important key issue that was raised there. Excuse me. Then another issue was a move from task shifting between the health workforce to task sharing. And again, you might recall the discussions around that. And then harmonization of data, so that the data is accessible, certainly within country, but in time, across countries, so that the responses then could be replicated across countries. Some of the challenges, the inadequate distribution of human resources for health affects the attainment of SDGs. And I think this was an important consideration, because I think all of us, as we ponder modes of delivery of health to our communities, the driver would be the SDGs. And I think this was an important point to make, that if we don't fix the adequacy of the health workforce, then we will not achieve the SDGs. What recommendations were made? Some of them, research the reasons for the high attrition of health workers. Include management training for healthcare professionals. Enhance a collaborative approach to address sustainability of a dynamic human resources for health environment, and ensure the equitable distribution of healthcare workers. I then want to go to the fourth plenary that discussed health workforce wellness, building resilience, building a resilient workforce. What were the key issues? Some of them included the responsibility of the practitioner towards the well-being of the patient, as well as their own well-being. This should be foundational to building a resilient workforce. And I think one statement that bears repeating here: building fulfilled healthcare practitioners as opposed to resilient healthcare practitioners. So people, because the resilient healthcare practitioners, at some point, they'll come to the end of their teeth and they'll burn out. So the concept must be that you want to build fulfilled healthcare practitioners. What challenges were identified? Conflict between the best interests of the patient versus the best interests of the practitioner. And might I say, this is a question that we actually were not able to answer adequately, I did not think, and I would imagine should be a focus of discussion in the near future. What recommendations were made? Improve the conditions of service for the workforce within government facilities, both from a resource point of view as well as from a human capital point of view, because there's no point increasing the one without the other. It creates frustration either way. Manage key psychosociological factors to improve healthcare worker well-being and reduce psychological harm. Create a work environment that motivates healthcare professionals to retain them and to attract new professionals into the workplace. The last session today was about strengthening sustainable health regulation and health workforce wellness. And that, the outputs from that section will be added to this report when it is then made available to yourself. So in conclusion, ladies and gentlemen, the key issues that arose from the discussions and recommendations made were the following. some of the recommendations, I think, are common, as you would have seen, as I reflected on the various sessions. But those issues that delegates thought required immediate attention were the following. First, AMCOA to provide progress on implementation of recommendations from previous conferences. Second, identification of leadership and infrastructure for the realization of the Pan-Africanization concept. Third, establishment of regional centers of excellence and the sharing of resources. Fourth, development of policy on curriculum review and standardization, the harmonization that we've been talking about. 5, standardization of requirements for registration and licensure across the continent. 6, enhance collaborative approach to address sustainability of a dynamic human resources for health and to ensure that health workers are equitably distributed. 7, to improve the conditions of service for the workforce. So, and again, from a resource point of view and a human capital point of view. 8, manage key psychosociological factors to improve healthcare worker well-being and reduce psychological harm. 9, create a work environment that motivates healthcare professionals to retain them and to attract new professionals into the system. And 10, an intentional move from task shifting to task sharing. 11, develop policies to address challenges in the use of artificial intelligence. And this, as we said, would certainly be part of the tool or the intervention that will enable improved access to low resource settings. And lastly, the need for new regulations for telemedicine, again, to improve access to care. This then, ladies and gentlemen, is the end of the report, and as I observed when I started, it will be, after it's been processed within the structure, it will then be made available to the member countries to go and do what they undertook to do at this meeting. Thank you, Chair.
Thank you very much, Prof. Rantwane. You have said a mouthful. What is important is that from the report, it becomes clear that from the chosen themes of this conference, that indeed we have attained the objectives of the conference. Each of the themes has an accompanying resolution. But what is also important, colleagues, is that we also need to remember some of to jog our mind, and thanks for the comprehensive feedback by Prof. Rantwane. Some of the main issues that were raised by the Minister of South Africa, and also by the Minister of Namibia. I'm not going to go into much, but issues such as shortage of the health workforce, remunerative work outside the public service, the usage of technology, the need to leverage staff on the usage of technology to improve service delivery. Honorable Minister Changula of Namibia also highlighted issues regarding cumbersome registration processes, the lack of recruitment practices, recruitment policies, uniform practice standards across countries and member countries of AMCOA. Remember the other salient issues which came out of the 51 breakaway sessions that took place in the course of the proceedings of this conference. As you remember, we held 29 breakaway sessions, took place on Monday, the 3rd of October. On the 4th of October, 22 breakaway sessions. As part of those breakaway sessions, in terms of which empirical studies, case studies and best practices were shared, there were a number of salient issues which came out from the floor. These include, amongst others, harmonization and standardization of curricula, quality health care, needs financing, more resources for professional registration and health regulation, the issue of perpetual candidacy in some cases, and most importantly, the health and wellness of the medical practitioner. From the report table